Hi, my name is Kunaal Motreja, and I'm a fourth year osteopathic medical student at Des Moines University. And today I'm going to be presenting on eating disorders in children and adolescents. In this presentation, we'll be discussing the following topics and questions, including what is an eating disorder, what are the different types of eating disorders, what are some signs and symptoms of when a children or teen starts to engage in disordered eating behaviors, what can we do as clinicians, and what does recent data show us regarding incidence of these disorders? So, according to the DSM 5, an eating disorder is defined as a behavioral condition characterized by severe, persistent disturbance in eating behaviors and is associated with distressing emotions and thoughts. Ultimately, eating disorders can impact individuals' psychosocial functioning, ultimately impacting their activities of daily living. They most often develop in adolescence and young adulthood and are more common in women and girls. However, it's important to note that eating disorders affect people of all genders, body sizes, ages, socioeconomic statuses, and racial or ethnic identities. There also tends to be a level of sociocultural pressure and biological bases when it comes to eating disorders. Sociocultural pressure for thinness may contribute to the onset of eating disorders. However, these disorders are increasingly understood to have a biological basis arising from interaction of both individual genetic vulnerability and environmental factors. Listed on this slide are the different types of eating disorders, including anorexia nervosa, bulimia nervosa, binge eating disorder, avoidant restrictive food intake disorder, pica, rumination disorder, and other specified feeding and eating disorders. We'll go over each of these disorders and discuss characteristics that differentiate them from one another. For patients with anorexia nervosa, there tends to be a disturbance in the way in which their body weight or shape is experienced. There may be an undue influence of body weight or shape on self evaluation, or a persistent lack of recognition in the seriousness of their current low body weight. Adults will typically have a BMI under 18.5. However, for children and adolescents, clinicians tend to use BMI per age for thresholds, and the specific threshold that clinicians look out for is below the fifth percentile. There are two different types of classes of anorexia nervosa, being restrictive type and binge eating or purging type. There's also an atypical presentation that can be shown with anorexia nervosa, in which an individual may appear normal physically and may not show any signs of severe weight loss or abnormal BMI. Like anorexia nervosa, bulimia nervosa also involves body image concerns. However, with bulimia nervosa, the individual will alternate between eating only low calorie foods and binge eating on high calorie foods, followed by compensatory behaviors, including self induced vomiting, laxative abuse, and excessive exercise. Individuals with bulimia can also appear slightly underweight, normal weight, or overweight, so physical appearance alone may not provide enough reasoning for suspicion of disordered behavior. With binge eating disorders, there are also episodes of binge eating. However, there are no compensatory behaviors to control weight. Involved in the diagnosis is also marked distress regarding the binge eating, and binge eating occurring on average at least once a week for 3 months. There are different ways to categorize the actual episodes of binge eating, including eating more rapidly than normal and eating until one is uncomfortably full. Of the different diagnoses we've discussed so far, the avoidant restrictive food intake disorder is actually relatively more recent. The diagnosis was introduced in 2013, and interestingly, it is also more common in males versus females. There are three different types of avoidant restrictive food intake disorders. One being the lack of interest in eating in general. With this, individuals tend to have a general low appetite and lack of interest in eating or food. The sensory type, individuals avoid foods based on sensory factors such as the texture, appearance, color, or smell of the food. There's also a fear of consequence type. With this type, individuals have anxiety or concern about consequences of eating, such as fear of choking, nausea, vomiting, constipation, or an allergic reaction. This disorder may develop in response to a specific event, such as an episode of choking or food poisoning. Patients with ARFID are also often underweight. However, the disorder can occur at any weight. So I actually saw a case of pica in my pediatric rotation. So it was interesting to get to review this for this presentation. According to the DSM-5, diagnosing pica requires each of the following: repeating eating of non-food substances that are not nutritional for at least 1 month. This may include, for example, eating hair, dirt, gum, paper, soap. The eating behavior is also inappropriate for the patient's developmental level and or not culturally supported or socially normal. If the eating behavior occurs solely in the context of another mental disorder, for example, autism, or general medical conditions such as pregnancy, the eating behavior is sufficiently severe to warrant additional clinical attention. Pica is also common in iron deficiency. So, before attributing pica to an eating disorder, the individual should be evaluated for iron deficiency using a serum ferritin or a full iron study panel. Typically, patients with pica also do not have an aversion to food in general, unlike some of the other eating disorders mentioned previously. Rumination disorder involves the repeated regurgitation and rechewing of food. Swallowed food is brought back up into the mouth voluntarily and is rechewed or reswallowed or spat out. To meet this diagnosis, this behavior occurs for at least 1 month. Regurgitation of food is not due to a general medical condition such as GERD, and regurgitation does not occur solely during the course of another eating disorder, such as the ones we discussed in this presentation already, including anorexia nervosa or bulimia nervosa. When clinicians are not able to meet the full criteria for a specific feeding or eating disorder, however, they still notice symptoms that cause significant distress or impair psychosocial functioning of patients, they will make this diagnosis of other specified feeding and eating disorder. One of the diagnoses that falls into this category is the atypical anorexia nervosa that we discussed earlier. Physicians may also use this diagnosis when they have insufficient information to make a more specific diagnosis, such as in the emergency room setting. Now that we've discussed the different types of eating disorders, let's go over some of the signs and symptoms you might notice when a child or teen starts to engage in disordered eating. Some warning signs might include changes in eating and diet, changes in exercise and movement, changes in behavior, in mood, or even in physical symptoms. There can be a whole myriad of medical and mental health consequences. Some of these medical concerns might include a rapid weight change, low heart rate, hormone changes, changes in electrolytes, general fatigue, breathing problems, hair loss, blood pressure changes, or even heart and rhythm abnormalities. Mental health concerns that can occur in individuals with eating disorders can include social isolation, loneliness, significant anxiety, symptoms of withdrawal, depression, and even suicidal ideation. As clinicians, it's important for us to know what we can do to support our patients and be better advocates for them. According to the American Psychiatric Association, the most effective current treatments are behavioral interventions. With this, a specific focus on helping individuals with an eating disorder normalize their eating and weight control behaviors is essential. Family based treatments also has strong evidence of helping patients, especially in the diagnosis of anorexia nervosa in adolescents. Helping parents and other family members build greater awareness around their child's meals ultimately will help create a stronger support system to make the entire experience easier on the kid. For those who are at a very low weight or who are severely ill, an admission to a specialized residential or hospital based treatment program may be advisable. Also, close outpatient follow up care is essential following hospitalization, mainly because of the high risk of relapse that is elevated for 6 months following an inpatient treatment. It's important that clinicians know what to watch out for and know to respond quickly. In general, the American Psychiatric Association suggests that one of the most important emerging predictors of treatment success for eating disorders across diagnoses is early behavior change. Unfortunately, with eating disorders, there seems to be an upward trend in diagnoses in recent years. In fact, one study shows that in the United States from 2018 to 2022, health visits for eating disorders more than doubled for children under the age of 17. Many factors can lead to an eating disorder. These can include genetics, environmental, and cultural pressures. The rise in eating disorders among children and teens during and after the COVID-19 pandemic could be due to a variety of causes. One effect of these causes is the large impact of social media. During and since the pandemic, kids have been spending more time online, where many social media platforms often show content that promotes unrealistic body standards. Also, some influencers on social media promote and glamorize fad diets that can be unsafe for teenagers. Addressing the risk of social media feels of the utmost importance now, especially with the rise of artificial intelligence. Talking to families and patients and answering any questions they may have are also a definite step that is surely in the right direction of reversing this upward trend. That's all I have for this presentation. Thanks for watching, and listed here are the different sources I used.